Do billing critical care evaluation and management services, or E&M, seem difficult at times? Are you receiving denials or overpayment requests for these services in the Medicare program and wonder what happened? We're here to help. In this video, we'll discuss updating coding guidelines for critical care, what you need to have in your patient's medical records when billing these services, and most importantly, coding your critical care claims correctly the first time. We'll do this by answering these questions. What is critical care? What is the difference between coding the CPT codes 99291 and 99292? What are the updated Medicare guidelines? For calendar year 2022, CMS updated guidance on critical care. We'll refer to these guidelines in this video. Next, who can perform these services? What documentation should you have in your patient's records? And what steps should you take to avoid errors in coding and documentation of critical care? So what is included in critical care? When critical care is provided to a patient, it includes these services: interpretation of cardiac output measurements, chest x-rays, pulse oximetry, monitoring of blood gases, any computer data including electrocardiograms, blood pressure readings, and hematologic data, gastric intubation, temporary transcutaneous pacing, ventilator management, and vascular access procedures. When any of these services are provided, they are not separately billable. However, other services provided during critical care can and should be reported separately. So let's talk next how to code for critical care. Critical care services are coded using CPT codes 99291 and 99292. CPT 99291 is for the critical care services from 30 to 74 minutes of time. CPT 99292 is an add-on code used for any additional 30-minute increments past the first 74 minutes of critical care provided to the same patient on the same day. With the updated guidelines, there are a few differences for coding critical care. One is in the coding of the time. For calendar year 2022 and beyond, CPT codes 99291 and 99292 are used to report the total duration of time spent by a provider for critical care services given to a critically ill or critically injured patient, even if the time spent on that date with the patient by the provider is not continuous. For medically necessary critical care services, non-continuous time can accumulate. However, you must devote your full attention to the patient and not provide services to any other patient during the accumulated time. This time must be recorded in the patient's record, addressing time engaged in all work directly related to the patient's care, whether at the patient's immediate bedside or elsewhere on the floor or unit. This includes time interacting with the family or any third parties regarding care management if the patient is incapacitated. So who can perform critical care? Critical care services can be provided by any physician or non-physician practitioner who is managing the critical care of the patient. Keep in mind, the care must be within the scope of practice and licensure for the state in which they are providing services. Providers bill CPT code 99291 only once per date, even if the time spent by the provider is not continuous on that date. Thereafter, the provider or any provider of the same specialty in the same group will report CPT code 99292 for any additional 30-minute time increments provided to the same patient. Critical care services can also be furnished as split or shared services. This guideline is new for 2022 and differs from the past when split or shared services were not allowed for critical care. For split or shared visits, the provider who furnished the substantive portion or more than half of the cumulative care reports the critical care services. Under the updated rules, the billing provider would apply modifier FS to critical care services in a split or shared situation. But what about other E&M services on the same date as critical care? Are these allowed? Yes, but with certain rules. In situations where a patient receives another E&M visit on the same calendar date as critical care services, both may be billed if the medical record documentation supports these specific criteria. First, the other E&M visit must have been provided prior to critical care services at the time when the patient didn't require critical care. Second, the services were medically necessary. And the services were separate and distinct with no duplicative elements from the critical care services provided later in the day. You would add modifier 25 to the critical care services on the claim when reporting critical care services on the same date as another E&M service. So what about critical care on the same date as a surgery? Is this allowed? Critical care services may be separately paid in addition to the procedure with a global surgical period if the critical care is unrelated to the surgery and the critical care is above and beyond and unrelated to the injury for which the procedure was performed. For example, critical care services could be unrelated to a surgery where a seriously injured or burned patient is critically ill and requires constant attendance of the physician. If so, the billing provider must include modifier FT on the claim for the critical care services. Keep in mind, medical record documentation must support your claims. So what are the documentation requirements for critical care? What will Medicare look for? Since critical care is a time-based service, you must document in the medical record the total time the critical care services are furnished, not necessarily start and stop times. Documentation needs to indicate medical necessity for the diagnosis or treatment of the illness or injury or to improve the functioning of a malformed body member, including any concurrent care by multiple providers. Concurrent services must be documented sufficiently to allow a medical reviewer to determine the role that each provider played in the patient's care. Additionally, all signatures in the medical record must be legible or electronic and easily identify the author. Keep in mind that critical care services may be subject to medical review by a Medicare contractor. So what can you do to prepare your critical care services should they be medically reviewed? You can prepare now by ensuring sufficient documentation is contained in your patient's medical record. First, thoroughly review the E&M guidelines in detail. We've helped lay the foundation with this video, but you'll want to understand all aspects of the guidelines in more detail. We've included a link to the CMS E&M guidelines in the video description below. Next, if the documentation is requested, make sure that all records are properly authenticated before submitting your documentation. Check those signatures. In addition, make sure records include authenticated orders for admission and that they were created timely. For critical care services, remember, time is essential. Be sure the medical record has the total time captured per patient per day. Next, consider self-auditing by reviewing your claims against these guidelines. The CMS Internet Only Manual, or IOM, is the basis for your auditing tools and contains the standards by which your records would be reviewed. Next, if your records are requested, you should submit adequate documentation to ensure that your claims are supported as billed, and be sure to respond timely. Depending on the type of request, you may have either 30 or 45 days to respond, but don't wait until the last minute. Remember, failure to submit proper documentation can cause the services to be denied. Make sure you have a process to properly receive additional requests for documentation and make sure the right people can respond timely. Finally, if your claim is denied and you disagree with the decision, you can request an appeal and submit your documentation following the guidelines that we've outlined here. A few pointers before we wrap up. Ensure your critical care claims are properly coded. The medical record should have the time documented for which you have billed. Bill your claims with proper modifiers. If billing split or shared critical care visits, include modifier FS with CPT code 99291. If billed during the global period of a surgery, include modifier FT with CPT code 99291. And if you bill critical care on the same date as another E&M service, bill Modifier 25 on the critical care service if appropriate. Be sure your documentation supports the services and the time that's billed. Finally, if your claim is selected for review, respond timely with the requested documentation. Doing these things will ensure that you avoid coding and documentation errors with your critical care services. If you'd like to learn more, check out our website. We offer excellent E&M Resources webpage to help with these services. And be sure to check the video description below for links to resources that I've mentioned, and don't forget to subscribe to our YouTube channel to access more of our educational videos. And as always, thanks for watching.